All right, so get ready for this, everyone. Today's deep dive, well, it's taking us into the maybe unexpected world of August promotions, for those home health and hospice agencies and private duty care agencies.
Yeah, maybe not the usual thing you think about for marketing insights, right?
Right, but that's kind of what makes it so interesting, I think.
Exactly. This document we're looking at, it's really a treasure trove. It's packed with info on senior demographics, even healthcare trends that everyone's talking about, and get this, the psychology of trust.
Okay, now you've got my attention. Seriously, Psychology of Trust from a home care marketing calendar.
Oh, absolutely. And trust me, these are insights that apply whether you're running a business or just, going about your daily life.
Right, so break it down for us. What's in this document?
Well, it's basically set up like a marketing calendar, broken down week by week. And weeks 31 through 33, they focus on things like eye health.
Makes sense, right? Summertime, people are outside more.
Exactly. And they tie it in with National Health Center Week, even hay fever season. It's all about what's going on right now.
So they're trying to stay relevant, topical, timely, all that.
Exactly.
Yeah.
But it's more than just raising awareness. It's about positioning these agencies as a resource,
Yeah.
being part of the community.
Okay, I like that. So how do they do that specifically?
Well, they suggest partnering with optometrists for eye health initiatives, sponsoring local events, even offering specialized services like think meal prep for people who have temporary vision problems.
Clever, right.
It is, and I bet that gets people thinking, hey, these agencies are thinking about my real needs.
Precisely. They're tapping into existing networks and concerns. Really smart way to connect with their target audience.
Okay, that makes a lot of sense.
Yeah.
But then it gets even more specific, right? I mean, they talk about things like distributing flyers for low vision patient care. Isn't that a little niche? It is niche, but that's smart targeting. It's not about shouting into the void. It's about identifying a need, finding a specific problem, and saying, hey, we've got the solution for a very specific group.
Makes sense. All right, so weeks 31 to 33 are pretty straightforward seasonal stuff, but then week 34, it's where things get a little, well, interesting.
You're talking about admit you're happy month.
I am. I mean, come on, is this for real? Admit you're happy month.
Right. I have to admit, I chuckled when I saw that too. But it got me thinking. They're focusing on happiness as a marketing angle, specifically for seniors.
Interesting. So it's not just about physical health anymore, but emotional well-being too.
Exactly. They're tapping into a much deeper need.
So what kind of things are they recommending? I mean, how do you market Admit You're Happy Month?
Well, think happy storytelling days at assisted living facilities,
Well,
or even contests like happiest person of the month.
okay, so maybe it's a little cheesy, but is it effective? I mean, is this common or is this document onto something unique?
Maybe admit your happy month is unique, but the idea behind it isn't. It's about associating your brand with positive emotions. Think about those commercials you see. It's not just logic. They want you to feel something.
Okay, so it's less about forcing happiness and more about smart association.
That's it. Very clever.
I'll give them that. But this document, it's more than just these weekly themes, right? There's also stuff about industry trends. Anything stand out to you there?
Definitely. They talk a lot about retail clinics, like you see at Walmart, and hospitalists as referral sources. It shows how healthcare is changing.
Becoming more, I don't know, accessible.
Yeah, exactly. People want convenience, affordability, and healthcare has to adapt. It's a big trend to watch, even if you're not in the industry yourself.
Yeah, for sure. And speaking of big trends, they also talk about changes to Medicare, which seems like a pretty big deal for these agencies.
Huge deal. The document mentions this shift toward value-based care.
Okay, so what does that mean, value-based care? I feel like I hear that phrase everywhere.
Basically, it means providers are being paid based on the quality of care, not just how many services they provide.
Ah, so it incentivizes a more preventative approach, right?
You got it. Less about just treating illnesses, more about promoting well-being overall.
And that impacts everyone, not just seniors, right? I mean, it's a whole shift in how we think about healthcare.
Absolutely. It's about a patient-centered system, which is a good thing.
Yeah, definitely. Okay, let's move on to the section on hospice marketing. I found it really interesting how they talk about reaching underserved populations, specifically ethnic communities. What's the significance there?
It's about recognizing healthcare disparities. Hospice agencies, they have to acknowledge these communities' needs and challenges. It shows they're committed to inclusivity.
It's more than just good intentions, though, right? I mean, they have to actually understand the nuances of different cultures.
Absolutely. Building trust is key. And they address some real challenges. Language barriers, cultural beliefs about death and dying, even just misunderstandings about what hospice care is,
It can be a tough subject to talk about.
for sure. But they offer some thoughtful solutions. Cultural sensitivity training for staff, clear communication about advanced directives.
Advanced directives, just to clarify, are legal documents outlining end-of-life care wishes.
Right, exactly. And this document also talks about the value of having bilingual volunteers. It's all about meeting people where they are.
Both literally and figuratively. Okay, so moving on, there's this section titled Private Duty, the Senior Psyche. Sounds a little intense, doesn't it?
It does, right? But it's really all about the psychology of trust. And it's essential when you're marketing to seniors. They might be cautious about bringing strangers into their homes.
Yeah, I can see that. And they have a quote here that really gets to the heart of it. The number one reason seniors will choose your agency, they say, is TRUST. Above all else, you must seek and win over their trust before you can effectively sell your services to them.
It's powerful because it's so straightforward. They're not sugarcoating it. Trust is everything, and you have to earn it.
And they go even further, saying to the senior market, honesty trust. So it's not just being trustworthy, it's being open and upfront.
Exactly. Seniors, they've seen a lot. They can tell when someone's being fake.
Makes sense. So how do these agencies build that trust? What do they actually do?
They talk a lot about consistency, reliability, sincerity in all interactions. It's not just saying the right things. It's about showing up on time, doing what you say you'll do, and treating seniors with respect. Real, genuine care.
So basically being a decent human being.
Pretty much. But they also talk about respecting individuality, understanding each senior's preferences, treating them as people, not just potential clients.
Okay, that makes sense. And they even go so far as to suggest offering written guarantees, which seems pretty bold.
It is bold,
Yeah.
but it shows how confident they are in their services. And it gives seniors peace of mind, which is so important.
Wow. Okay, so we've uncovered some pretty fascinating stuff already, from seasonal marketing and the importance of cultural sensitivity to, the psychology of trust. But we're just getting started with this document.
We are just scratching the surface. There's so much more to explore. And, we were just talking about reaching diverse communities. Well, this document actually takes it a step further. It lists 9 specific underserved hospice markets, like really encouraging agencies to think outside the box.
9. Wow. Okay, I'm intrigued. Lay it on me. What are they?
All right, so we've got children, people in correctional facilities, individuals with disabilities, people with specific diseases, ethnic communities, which we touched on, faith-based groups. Oh, and geographically isolated populations, veterans, even workplaces.
That is a broad spectrum. So
Yeah.
what's the common thread? Why are these groups underserved?
It comes down to this. The need for compassionate end-of-life care. It goes way beyond that traditional image we have. The senior citizen at home, these groups, they face unique challenges.
Like what kinds of challenges?
Logistical barriers, for one. Cultural stigma around hospice care. Sometimes it's just lack of awareness.
So this document, is it like a call to action for these agencies to step up and fill the gaps?
Exactly. Promote equity in end-of-life care. Make sure everyone has access to support, no matter who they are or what their situation is. It's a powerful message.
Absolutely. And then it gets kind of interesting. The document actually talks about the importance of not selling. Did I read that right?
You did. Sounds
No.
strange, I know, right? In a document about marketing.
Yeah, little counterintuitive.
But what they're saying is sometimes the best way to sell is not to sell at all.
Okay, I'm listening. So if they're not pushing their services, what are they doing?
Educating. They want agencies to educate the community about hospice care. Address those misconceptions we talked about. Build relationships with doctors, social workers, those key referral sources. Even offering free workshops, partnering with other organizations. It's all about being present, being a resource.
So less about the hard sell, more about positioning themselves as the trusted experts, letting the quality of their work speak for itself.
You got it. Earn that trust through education, community engagement, and genuine compassion. No slick sales tactics needed.
Makes you think, doesn't it? It's like that selling happiness idea we discussed earlier.
It is. It's less about making promises and more about creating a genuine culture of care. Something that's evident in everything the agency does.
And people can sense that, right? That genuine concern versus just trying to make a buck.
Oh, absolutely. Authenticity builds trust, loyalty. That's what makes people come back.
And choose you over someone else. This whole conversation has me noticing a theme: consistency.
You're picking up on something important.
Hmm.
They really stress consistent messaging, consistent branding, especially when you're reaching out to these diverse communities.
Builds recognition, right? And trust, especially for those who might be hesitant about hospice care.
It's about having a clear identity. a brand that reflects their values,
Mhm.
and using that consistently everywhere. Brochures, websites, social media, the whole 9 yards.
Right, it's got to be cohesive.
Yeah,
But it goes beyond just the visuals, right? I mean, they talk about using language that's appropriate for each culture, imagery that resonates.
exactly. You have to tailor the message to address specific concerns or misconceptions within different groups.
Again, meeting people where they are, showing that you get it, you understand.
Right. And that you're committed to communicating in a way that makes sense to them, a way that's both sensitive and effective. But, we can't talk about marketing strategies without talking about results,
Yeah,
right?
for sure. What
Yeah.
gets measured gets managed.
Exactly. They emphasize tracking key metrics, website traffic, social media engagement, where referrals are coming from, conversion rates, all that good stuff.
So you can see what's working, what's not, make adjustments as needed.
That's the idea. It's about doing good effectively. But they also talk about getting feedback directly from people, like through surveys or focus groups.
Makes sense. Numbers tell one story, but you need to hear from people to get the full picture.
That's it. Combine the numbers with what you hear, and you get a holistic view. You see your impact and where you can improve.
It's making me think about self-reflection, not just in marketing, but in life.
I like that. Evaluating our efforts, asking for feedback, making changes. That's how we grow,
Yeah.
personally and professionally.
Yeah, it's being intentional, realizing what we might be missing, and always trying to learn to do better.
Couldn't have said it better myself.
Yeah.
It's like we should all ask ourselves, am I really making a difference? What can I improve?
Great questions. Okay, so we've talked data, consistency, but there's another powerful tool this document highlights: storytelling.
Ah, yes. Storytelling. The universal language. It crosses cultures, connects with us on such a deep level.
And they're saying these agencies should use it to personalize their message, humanize their brand, create an emotional connection with their audience.
Because stories, they make information stick. It's one thing to hear stats about hospice. It's another to hear a real story about a patient who found peace, a family that felt supported.
It's about making it real, relatable, and they even suggest sharing stories that challenge common misconceptions about hospice.
Exactly, like that it hastens death or is only for the very end. Storytelling can change perceptions, open hearts and minds.
It's powerful stuff. So, for our listeners, what's the takeaway here? How do we use this power of storytelling in our own lives?
It's about finding that human element in every situation. What's the emotional core of your message? What story will resonate?
Because a good story can inspire, educate, even heal. It can build understanding, create connections that last.
Beautiful. And the power to tell those stories, it's within all of us.
Yeah, as we've gone through this document, it really strikes me how much they emphasize trust. Like it's at the heart of everything, the marketing, the caregiving.
Yeah, it is, isn't it?
Yeah.
And it makes sense if you think about it from the senior's perspective. You're letting someone into your home at a time when you might be feeling vulnerable.
Right, maybe dealing with health issues, needing help with things you used to do on your own.
Exactly. Trust isn't just a bonus, it's essential. And the document actually breaks down the components of trust: honesty, reliability, sincerity, and respect for each person's individuality.
Which, I mean, those all seem like basic human decency, don't they? Like, why even spell it out?
Because it's easy to lose sight of that. In today's world, everything's so transactional. We forget about genuine connection.
Especially in healthcare, where the stakes are so high, people need to know they matter, that they're more than just a number on a chart.
Absolutely. And these agencies, they're demonstrating that through actions, not just words.
So it's not enough to just say, hey, trust us, you have to prove it.
Exactly. They're showcasing their experience, using testimonials from happy clients, offering different service options so people have choices. They even offer written guarantees, which is pretty impressive.
It is. It's like they're saying, we're so confident in what we do, we're willing to put it in writing.
Right. And that empowers seniors, gives them the information they need to make their own decisions. It takes away some of that anxiety, which is so important when you're dealing with things like end-of-life care.
Absolutely. Okay, so let's zoom out a bit. What can we learn from this about building trust in any relationship, not just in a healthcare setting?
It all comes down to walking the walk. Does what you do match what you say? Are you reliable? Do you follow through? Do you treat people with respect, even when it's hard?
Because it's those little things, right, that build up over time or break down trust if we're not careful.
Exactly. And once trust is broken, it can be so hard to earn back. It's a good reminder to be mindful of how we impact others, even in small ways.
Great point. Well, we've covered so much in this deep dive: seasonal marketing, psychology of trust, the power of stories.
It's been quite a journey.
It has. So, as we wrap things up, what's the one big takeaway you hope people remember from all of this?
I think the biggest lesson is that we can find wisdom in unexpected places. Even a document about marketing for home care agencies can teach us about human nature and how to build strong relationships. And these principles, they apply no matter what you do or who you're dealing with.
It's about being genuine, showing empathy, making those real connections with people. That's what makes for good marketing, good leadership, good relationships, everything.
Couldn't agree more.
So, to leave our listeners with something to think about, if trust is the foundation of any successful interaction, how can you invest in those connections today? What can you do, even a small thing, to build stronger, more authentic relationships in your own life?
Start by paying attention. Be
Mm.
present in your interactions. Really listen to people, show that you care. Those little things, they add up.
They really do, and they can make a huge difference, not just for the people around us, but for ourselves too. Well, on that note, thanks for joining us for this deep dive. Until next time.